Your CNOS Health Watch on Siouxland News.
Do you have knee pain but can't recall getting an injury? Well, there may be an explanation. Here's Siouxland News reporter Katie Link with tonight's CNOS Health Watch.
There are two menisci, one on the inside half of the joint and one on the outside half of the joint. And those two structures basically act as cushions between the thigh bone and shin bone, so they're shock absorbers, if you will.
CNOS orthopedic surgeon Ryan Meis says knees don't keep their cushion forever.
So as we get to be a little bit older, even as early as our 40s and certainly in 50s and 60s, the meniscus becomes a bit more friable and more prone to injury, even without some type of traumatic episode. In fact, most of the meniscus tears we see in people who are 50 years old and beyond aren't from an injury at all. It's just mild wear and tear that occurs to the meniscus, and then a small cleft or tear occurs.
Dr. Meis says it's probably a good idea to get it checked out if you're having pain squatting down or climbing stairs.
Joint or more towards the back, it's very commonly going to be a meniscus tear.
Here's the bad news. There's not a lot you can do if you get a tear.
The problem with the meniscus is that it has a very poor blood supply. So once it gets a tear, it has no capacity to heal itself. So if you get a small tear, that loose fragment will flip back and forth and cause pain in the knee joint.
If the pain is too much, surgery is an option, but it could cost you down the road.
Treatment: if there's a tear, you remove the torn fragments but leave any healthy tissue behind because it's there for a reason. It's a cushion. And without that cushion, you can potentially increase the risk of having arthritis later in life.
For Siouxland News, I'm Katie Link.
If you do develop severe arthritis down the road, there are more treatment options for that, including knee replacement.